Here is something strange. Your tendon hurts when you start moving, and then after a few minutes it actually feels better, and then later it's painful again. That's not how most injuries behave. So what is actually going on? That's what we are going to see in this video. A quick note before we start the video: this video is only for general education purpose. If you have ongoing pain, it is always better to consult a qualified healthcare professional. Most of us think about injury in a very simple way. Something gets damaged, it hurts, it heals, and the pain goes. The tendon pain does not follow that pattern, because tendon behaves like a load responsive biological organ. And once you understand why, the whole problem becomes much clearer. Let me walk you through 3 key ideas about this. The first idea is your scan and your pain are not the same thing. Some people have a tendon that is quite abnormal on a scan but very little pain. Others have lot of pain but only small changes on the imaging. So one important thing to understand is this: pain does not always match what we see in the tendon structure. That doesn't mean the scans are useless. They still give us a lot of information, lot of valuable structural informations, but they don't tell the whole story. The whole scenario, whole context is very important here, the clinical context. So if you have ever been told your scan looks bad but your symptoms didn't feel that severe, that is why. Second idea, that warm-up effect. The warm-up effect is actually the clue. Pain at the start, better as you continue walking, running or jogging as the day goes by, and worse again, worse later. Many people recognize this immediately as you are watching this video. This tells us something important. The tendon is closely linked to how much load the tendon is handling. Tendon is a thick cord-like structure which connects the muscle to the bone. A simple way to understand this is every tendon has a capacity and how much load it can tolerate comfortably. Every activity that we are doing places a demand on that tendon. So when the demand and capacity are well matched, things feel fine. When the demand is more than the tendon is ready, then the pain appears. So instead of thinking my tendon is damaged so it hurts, it is more helpful to think my tendon is currently struggling to handle the load I am placing on it. And at the start of the activity, sudden demand, pain happens. As you continue, the tendon adjusts, the pain reduces. Later, the load adds up and then the pain returns. That's what exactly happens. So that warm-up effect is not a random phenomenon. It is a valuable clue about how your tendon is responding to the load. Idea number 3. It's not just a simple inflammation problem. So the entire medical fraternity were thinking that it's just simple inflammation problem. And we were giving the word ITIS for every word. And word ending with ITIS means there is an inflammation. But in its long-standing tendon problem, the picture is usually more complex than that. Instead, what we often see are changes in the tendon structure, changes in how tendon cells behave, changes in how signals are getting processed. So a more accurate way to understand this is a long-standing tendon pain is usually not best explained as a simple inflammatory condition. Take this message clearly. It's not a simple inflammatory condition. That's one reason why complete rest does not always solve the problem and why recovery often needs the right kind of loading. And here is something most important. Most people are never told about tendon pain. It is not coming only from the tendon itself. Your body, your brain constantly picking up signals from the tendon. It processes them and deciding how strongly to respond to that. That is why you might notice something like this. The same activity, the same movement, but on one day it feels like fine and another day it feels much worse. This is the reason why. Nothing dramatic has changed in the tendon overnight, but your system is responding different. So a helpful way to think about this is tendon pain is not just about what is happening in the tissue. It is also about how your body is interpreting those signals. That doesn't mean the pain isn't real. It absolutely is. It just means there is more than one layer to it. Now, if you put all this together, pain doesn't always match structure. Pain depends on the load, and it is not just simple inflammation, and your nervous system also plays a vital role in this. It becomes clear why tendon pain feels confusing, because it doesn't follow one simple rule. If you remember just few things, pain doesn't always match what we see on the scans. Number 1. Number 2, tendon pain is closely linked to load and activity. Number 3, it's usually more complex than simple inflammation. inflammation. Number 4, and both the tendon and the nervous system influence the pain. In the next video, I'll explain how tendon problems actually progress over time and why early stages behave very differently from long-standing ones. If this helped, like the video, share it with someone who might benefit, and subscribe for more evidence-based health content like this. I'll also put you the QR code of my WhatsApp channel at the end. You can join there for more updates. This disclaimer, this video is only for general education purpose only. It is not a medical advice, diagnosis or treatment. Individual conditions vary and decisions about care should always be made in consultation with a qualified healthcare professional. This video does not create a doctor-patient relationship. See you in the next video. Goodbye.